The exciting program that I'm offering as a win-win to other psychiatrists who are treating people with AIDS and the mom and dad of those psychiatrists as patients is called the Schizophrenia Family Healing Program. So I would serve as a consultation liaison psychiatrist doctor. I would work primarily with the mom and dad, to some extent with the patient, but really the patient is going to be someone who's being treated by a different psychiatrist, not me. So he and she, that other doctor, and I would have a consultation relationship. And in my residency training, consultation liaison psychiatry was huge. We did a lot of consults on each other's patients at the Mayo Clinic in Minnesota. So we had a group of, you might say, siloed experts. You have the heart doctor, the kidney doctor, the cancer doctor, and in my case, the psychiatry doctor. And we would talk to each other. We'd have a case, but no one is simple. Every human is really complicated. So most of us would ask for a consultation from whatever service we thought needed. And the other doctors would swing by, they'd review the chart for a day or some time, they'd talk to the patient, and they'd give us a report on what they thought we might add to their treatment to have the greatest degree of success on the other doctor's patient. So me working with the schizophrenia family is to really address something that's been, I think, neglected in modern psychiatry, in the hospital and in the clinic, which is to work strongly and powerfully with the family. One frustration that this 12-month program and the resources on the internet, the book I'm about to write, addresses is the fact that when a patient with schizophrenia is in the hospital, there's lots of federal government rules about privacy. In the United States, it's called HIPAA, and just a bunch of letters for the healthcare, service thing. So HIPAA is the letter, but it prevents the people in the hospital from revealing information, even revealing if that person that might be on the phone call, the mom or dad, saying, "Hey, is my son Johnny in the hospital?" They can't say, "We don't know if Johnny's here or not. We can't say anything about Johnny." So they cannot even reveal that Johnny is in the hospital. So the family is really scared and confused. And my program to work with families is really to help bridge that gap of communication. The other thing about this 12-month Schizophrenia Family Healing Program, it's a concierge psychiatry program where I'll be having lots of contact with the family. And the ideal is to improve that system. And using systems theory, which is something that James Greer Miller devised decades ago. And he used systems theory in corporate America and other corporations around the world successfully for decades, and his companies use these methodologies on systems theory. And it involves the idea that we're all made of systems. So the biology person, our body, or any cat or dog or animal, we have our DNA, the nucleus, the cell, groups of cells, organ systems in our body, and then the whole functioning organism. So we have this complexity of systems just in a person, or a cat or a dog, or a horse or anything. And then when you get to a village or a city or a county or a nation, it's a larger system. And then you have economic systems and all these different systems. Another type of system is, of course, the hospital system. But my 12-month program is working on the family system, where there's the mom and the dad, or some people call it the major attachment figures. See, if you're in Ricky Martin's family, you got two dads and a kid, so there's not mom and dad. But anyway, the parent leaders, whoever they are, mostly it's going to be a mom and a dad, a mother and a father. That's the majority on our planet.